Osteomyelitis, when it's chronic, which is one of the most common the images shown to you in orthopedics, think about sequestrum, the dead bone, which is diagnostic. And when you remove the sequestrum, the live bleeding bone comes. That's called as the paprika sign. Remember, multifocal osteomyelitis, that is osteomyelitis involving the multiple bones, right? Safo syndrome is number one. Safo syndrome is a misnomer. It is actually an osteitis. But if they ask you which is multifocal osteomyelitis, choose Safo syndrome. Second common is sickle cell anemia with salmonella infections. Faber, flexion, abduction, externodation of the lower limb is a position of increased capacity of the hip joint, which is seen in synovitis, infection, anterior dislocation, and when there is iliotibial band contractures. Faber is usually associated with lengthening. Opposite of it, flexion, adduction, interrotation, that is FADER, is indicative of arthritis or posterior dislocation. So posterior dislocation more common than arthritis. Trauma, posterior dislocations are much more common than anterior dislocation. That is why Faber, anterior dislocation is a cause later. But in FADER, posterior dislocation is number one cause. And remember, FADER, shortening is there. Faber, lengthening is there. If you look at the infections of the joints, they are surgical emergencies called as septic arthritis. Organism is Staph aureus. Less than 5 years, toxic child. Compared to it, transient synovitis, temporary proliferation of synovium, age group is 6 to 12 years, non-operative management.